Bitsy, this is my ostomy checkoff video. It is on a makeshift little drawing since we are not allowed in the lab. I do not have a real person to do this on. So the first thing in doing the ostomy checkoff video is to perform my co-wipe. I'm going to check my order, which my patient has an order for their ostomy bag to be redone. I know that it is, ordered because the fact that it's dirty and it's been a couple of days since it's been changed. I'm also going to inquire about my patient's allergies, in which my patient does not have any. I am going to verify my patient using 2 patient identifiers, checking their name and date of birth on their wristband and asking the patient what that is. I am going to wash my hands. I'm going to provide for privacy. I am also going to explain and educate my patient on what I'm doing. And then I would go ahead and start. So the first thing I'm going to do is wash my hands. I'm going to go ahead and put on some gloves, which I do not have out. So I'm going to put on my gloves, and I am going to provide for privacy by closing the door. I introduce myself to my patient. Hi, I'm Bitsy. I'm going to be your nurse taking care of you today, and I'm going to go ahead and change your ostomy bag. Ask him, have any allergies? Patient states no allergies. Ask name and birth. Patient states name and birth. It's verified on their wristband. So at this point, I'm going to go ahead and make sure my patient is in a position of comfort. They can be sitting on a commode, or they can be in a low semi-Fowler position on the bed. In doing this is a procedure that the patient can help me with at any time. First thing that I'm going to do is assess the skin around. There's no swelling in the abdomen. There's no bruising noted, no redness noted, no distension at all. I do note that the bag is soiled. There's brown feces in the bag, very liquidy in form. And once I have assessed my bag and I have assessed my patient's abdomen, I assess the skin around the area, and now I am going to remove the old bag. I have my gloves on, so removing the bag, I am going to unsnap from the base and I would take this bag into a bedside commode or a bedpan, empty it out, irrigate the bag out, clean it with some soap and water, make sure that the bag is dry. And I'm going to go ahead and leave that bag placed in the bedpan until I am done. If I was going to reuse the bag. In this case, I'm not going to reuse the bag. I'm going to get a new bag. While that is off, I am going to use soap and water. The soap or cleaning agent needs to be of a pH of 5.5, and the water needs to be warm. I would cleanse around the area right here, keeping the plasticky stuff clean, and I would irrigate around the actual ostomy itself, disposing of all of that stuff. While I am doing my next step, I'm going to take a clean, sterile 4x4 and place it over my patient's stoma so that I can keep it from getting any kind of bacteria or infections on it. At that point, I would take it off to do a quick measurement of my patient's stoma, and it appears that they are 1.5. So I would cover up my patient's stoma, and I would cut this to the 1.5 mark. Once that is cut and ready to go, I am going to go ahead, dispose of my gloves. I'm going to rewash my hands. I'm going to put new gloves on, and I am going to come back to my patient. I'm going to remove the 4x4 over the ostomy, and I'm going to remove the backing. and I am going to place it over my patient's ostomy, making sure that there are no wrinkles in this so that the skin is not irritated, making sure that the hole is big enough for the ostomy and it's not going to be rubbing up against it, causing any kind of irritation or bleeding at that point also. I would go ahead and grab my new bag, connect my new bag onto the patient, making sure that there is a clamp at the end of this. Once I have completed those steps, I am going to go ahead and I've got the proper stuff on, checking that, checking again, making sure there's no irritation from what I had done to the patient. And I am going to describe what an irrigation, ostomy irrigation would be used for. Basically, it's irrigating of the colon so that you're able to start to control the bowel movements and keep them regulated. At certain times, you would do that irrigation so that you set that initial time for the patient. After I have explained that to my patient, I'm going to go ahead and make sure that my patient is still comfortable. I'm going to make sure that they are back in bed and that they have their call light if needed. Let them know they can call me if they have any concerns. I'm going to go ahead and take my gloves off, wash my hands, exit the room, and document everything that I have done. In the documentation, I would put how much the patient assisted me. I would put the size of the ostomy hole, which was a 1.5. I would note if there was any abnormalities or any difficulties in the process of cleaning and replacing the ostomy bag. I would note the amount of feces, the color of feces, and the consistency of the feces, and of course the time that the procedure was done. That's it.